Welcome to Advanced Cosmetic Solutions. We are an aesthetic treatment facility focused on the face, but we certainly do other treatments as well. Our emphasis is going to be on very personalized treatment directed at you and your needs and desires, and perhaps sometimes things that we see as well. From the minute you walk in the door, you're going to have very personalized service. Chris will answer the phone or greet you as you come in the door. She is very knowledgeable about the products that are sold every day and commonly prescribed through our clinic. She can talk to you and get you a better idea of which way you want to be directed for your first consult at our facility. You'll likely meet Trish for a skin consultation, daily maintenance and improvement therapies, and certainly other treatments such as laser and skincare treatments. If you are directed to see me, we will talk about things varying from blepharoplasties to brow lifts to cheek lifts and Botox and Juvederm. A blepharoplasty simply means a lid lift in common terms, or removing skin and fat from the upper and or lower lids. We do this most commonly in the office under local anesthesia. It takes anywhere from 45 minutes for an upper lid procedure to perhaps an hour and a half for an upper and a lower procedure. Relatively painless procedure, and recovery time is approximately a week before you're returning to most of your normal activities. Most people can expect possibly 10 days to 2 weeks of bruising and swelling. It's important to plan for that kind of recovery time in your social life and your personal life. The common blepharoplasty candidate that we see is somebody who is anywhere from 30 to 70 or 80 years old. They have heaviness of the eyelids, fullness of the upper lids, bagginess or hollowness below puffy lower lids. They're unhappy about the way they look. Most commonly, people are complaining that everybody thinks they're tired, that they haven't slept, or that they're half in the bag when they're fully rested. These are excellent candidates for surgical rejuvenation of the eyelids. The easiest recovery and happiest patients of all the cosmetic surgeries that we do are probably the endoscopic brow lift patients. 3 small incisions are made up in the hairline centrally, 1 in the middle and 2 on either side, and then 1 out in the hairline above the ear. From there, we use cameras and very small instruments to go down and essentially lift the eyebrows and scalp and bring it up to the desired level and contour of the eyebrows. It's a dramatic surgery and dramatically highlights the eyes when they're done. Patients not only have lighter and wider looking eyelids, but they also have a much smoother forehead and a feeling of lightness in the forehead. They lose that heaviness that they all have. There's typically very little bruising and swelling with this, and downtime from bruising and swelling and limited activity is even less than with a typical blepharoplasty. The typical brow lift patient is someone who comes in with that feeling of heaviness, and they will sit there and they will do this, elevating their brow, and they will tell you that they just like the way it looks, that years ago they used to have a nice higher brow and arched, and now they have a heavy feeling, and they feel that their eyes are getting smaller and their brows are feeling heavy. A mid-facelift is perhaps the most involved of the surgical procedures that I do. It's a very powerful regeneration tool in patients who are good candidates for it. Typically our approach is through the lower lid with perhaps a small incision at the corner of the eyelid to help further tighten the eyelid along with the mid-face. This minimally invasive approach does not leave any significant scars and has a very powerful effect on rejuvenating the mid-face in a lifting sense. It smooths out the nasolabial fold, it can get rid of the hollows and bags under the eye at the same time, and even lift up a little bit of a jowl at the jawline if you're starting to have one. A typical patient for a mid-facelift is somebody who really is bothered by the aging changes they see from the lower lid all the way down through the cheek and even sometimes down to the jawline. The best mid-face lift candidates are those who are not typically ready for a full facelift or necessarily need a full facelift. You'll find those patients, facelift patients will come in and they'll pull themselves this way, and they're a good candidate for a facelift if they like what they see. But a lot of people come in asking for a facelift, pulling their cheeks up and pulling up like this. And those are the patients who are a good candidate for a mid-facelift. The ideal mid-facelift candidate, however, is a bit younger, probably from the 30s through the 50s, depending on how healthy their skin is and how full their faces are. In other words, whether they've had fat atrophy or loss and thinning of the face as they've gotten older. Older patients can be a candidate. If the skin is too thin and they don't have enough volume, then a mid-facelift kind of gives you just a simply pulled look. I'm sure everybody's seen people who've had facelifts and who maybe they thought had a bad facelift. They were probably just not good candidates for a facelift. They end up with that windswept look because their face is so thin. What really happens when a face ages is that you lose volume, and rather than truly stretching out, when you lose the supportive volume, then everything sags and looks stretched out, and simply stretching it back isn't going to replace that volume, which will take us into other procedures that we do most commonly, which are the fillers and Botox as well. Dermal fillers are an excellent aesthetic rejuvenation procedure. There's no downtime to them. They're minimally invasive, simply injecting a filler substance into or below the skin to contour the face. It's a wonderful procedure. We can sculpt faces in any way we want, filling in very focal, local defects all the way to filling up whole faces and doing what we call the injectable facelift. It's a great procedure, again, with minimal downtime, occasionally some bruising that can last a couple weeks but can be covered with makeup. The fillers that we have available today, most commonly I use Juvederm, but there are others as well that are good, are natural substances that are made from the exact same material that is in your skin. They act as water magnets, bringing water into the skin, which is good for it. They stimulate collagen production, and they fill up the face and last upwards of a year. So patients can typically expect to only need a treatment and retreatment every 9 to 15 months. Botox is also one of our top procedures. Again, a minimally invasive treatment. Patients can come in for an injection and be right back at whatever activity they want to do right away. The Botox typically lasts anywhere between 3 and 6 months, depending on how often you've had it done, how well you keep it up and not letting it wear off, and which region you're having treated. Crow's feet often need retreatment every 3 to 4 months, and that's the little smile lines around the eye. Foreheads can typically last about 4 months. The frown lines that we do here, which is probably the most popular for people, last anywhere from about 4 months to even upwards of 6 to 9 months, mostly because as you keep up your Botox, you forget and your brain forgets how to frown. So even when the Botox is worn off, people don't tend to frown very much and oftentimes can go longer with the Botox. Botox is a very amazing medication or drug. It has a lot more uses even just beyond pure cosmetic wrinkle reduction. We can do it for sweating reduction. We do a lot of patients who don't like how much they sweat, either on the palms of their hands or under their arms or other areas of the body. It can significantly reduce the amount of sweating for anywhere from 4 to 6 months. I have a lot of patients that we treat for migraine headaches and chronic pain syndromes with Botox. There are many other uses for Botox, and those we can always talk about that. The one thing that we pride ourselves on at ACS is individualizing every consult to the patient and not trying to push anything on somebody. Our most happy patients are the ones who come in who've been thinking for years about doing something and didn't really know what could be done. And were afraid to have surgery, but were thinking that that was the only thing that could be done. Our treatments that can make a huge difference in how you look and how you feel about yourself and how you age start from just daily skincare products and better care of your skin and healthy lifestyle habits to simple glycolic peels and other types of minimally invasive lasers, which can just make your skin glow and feel better and slowly tighten it over time. And it varies all the way up to the surgical procedures that we talk about. Some patients do come in right away and say, I want a brow lift and a cheek lift, and I don't think they're a good candidate for them, but we can often make them happy with other treatments. So our approach is very individualized to that patient, to their desires, and trying to center on helping them feel better about what's bothering them. You are going to have a very personal and individualized experience that we feel that your desires and needs have been met and addressed, and a plan has been formulated to make you feel better, look better, and age better. Why not come down and see what we can do for you?